Hello everyone, my name is Aina Najwa. I'm a 4th year student majoring in Medical Physics at University Science Malaysia. In this video, I will discuss on the topic Therapeutic Ultrasound in Physical Therapy. Let's get started. When you hear the word ultrasound, what is the first thing that comes to your mind? I'm sure that most of us will relate ultrasound with the one that being used to see inside our body, such as to generate image of womb during the pregnancy. But actually, do you know that other than for diagnostic purpose, ultrasound also is commonly being used in physical therapy by the physical or occupational therapists. Ultrasound is sound wave with frequencies higher than the upper audible limit of human hearing, which means human can't hear it. It has frequencies higher than 20 kHz. In this line range, you can see the frequencies of ultrasound wave compared to other sound wave. Ultrasound therapy is a therapeutic treatment that utilizes high-frequency sound wave that cause vibration and movement of cellular fluid of the tissues in the body. Mainly, ultrasound therapy is used to treat injured soft tissues that include muscles, tendons, ligaments, and joints. These injuries are usually experienced by the athletes and are classified as sport injury. Examples of soft tissues injuries that can be treated using ultrasound therapy are bursitis, tendonitis, muscle strain and tears, and ligament and tendon injuries. Ultrasound therapy is used for the purpose to reduce pain, increase circulation of blood to injured area, increase mobility of soft tissues, reduce inflammation, and increase healing of wound and injured area. Ultrasound is produced within the machine by application of alternating current to an ultrasound transducer, which is known as ultrasound probe. Here is the picture of ultrasound probe, which contains crystal within its head. As electrical current is applied, the crystals within the head of ultrasound probe will vibrate rapidly at particular frequency. Vibration of these crystals cause a piezoelectric effect within the head and generate the ultrasound wave. The ultrasound wave passes through skin and causes vibration of soft tissues. The vibration causes heating towards tissues, increasing blood flow and cavitation. But don't worry, because patient will not experience any sensation of heat during the therapy. Ultrasound is applied using therapeutic ultrasound machine. This is a model of endophthalmic Sonopulse 490, which is one of the machines that is used by physical therapists in treating soft tissues injuries. On this machine, there are several buttons and a display screen for the settings of parameters in order to control depth of penetration of ultrasound wave according to type of soft tissues injuries. The parameters are frequency, percentage pulse duration, treatment time, and intensity of ultrasound. Firstly, the physical therapist will set up the parameter setting. Frequency used is either 1 MHz or 3 MHz. 1 MHz is used for deeper soft tissues with depth of 3 to 5 cm, and 3 MHz is used for shallower portion of soft tissues with depth of 1 to 2 cm. Percentage pulse duration vary from 0 to 100%. 100% represent continuous ultrasound, while the remaining represent pulse ultrasound used for treatment. Treatment time usually less than 10 minutes to avoid overheating to the tissues. Intensity varies depending on type of injuries and desired effect. Next, a small amount of ultrasound gel is applied to the particular body part that injured. Ultrasound gel is a medium that provides close contact between ultrasound probe and skin. It also reduces friction and increases transmission of ultrasound wave to injured area. Then, ultrasound probe is directly placed on skin and is moved slowly in constant circular motion to prevent burning to the patients. If the probe is kept at one spot, it accumulates more sound wave and causes too much vibration that later causes pain to the patient. Therapeutic ultrasound is used for two different effects, which are thermal and non-thermal effect. In thermal effect, ultrasound provides deep heating to soft tissues, and this is achieved by using continuous ultrasound. Heat produced from the ultrasound is slowly dispersed through the tissues in a process called conduction. This increases tissue extensibility, increased blood flow that aid in healing process, reduce pain, mild inflammatory response, reduction in joint stiffness, and reduction of muscle spasm. This effect is preferential to heat tissues with high absorption coefficients such as tendon, ligament, and joint capsule. In non-thermal effect, ultrasound introduces energy into the body. The energy causes microscopic gas bubbles around tissues to expand and contract rapidly. This process is known as cavitation. Expansion and contraction of these bubbles help to speed the cellular process. It stimulates fibroblasts and collagen, and hence increase healing of injured tissues. There are two types of cavitation, which are stable and unstable cavitation. Stable cavitation is the one desired for the therapeutic effect, while the unstable cavitation will be avoided as it can damage the tissues through release of free radicals that increase pressure and temperature to tissues. Other non-thermal effect is acoustic streaming. Acoustic streaming provides steady circulation of fluid around cells and affects the cell permeability and activity. It increases protein synthesis that aid in healing process. Ultrasound therapy is a good choice for patients with soft tissue injuries. It increases blood flow, increases relaxation of muscle, breaks down scar tissue, and increases healing rates. Despite obvious advantages, however, ultrasound therapy is not suitable for all people. It gives risk towards pregnant women, people with malignant growth, and also people with cardiovascular issues. For the conclusion, therapeutic ultrasound is widely used in physical therapy to treat soft tissue injuries. But always remember to seek the doctor first before getting any therapeutic ultrasound treatment.